Once a diagnosis of interstitial lung disease is made, it can be really overwhelming because there's just a huge amount of information on the internet. A lot of it is just not applicable to our patients who have myositis-associated ILD. And so I think that getting that kind of good quality information is very important. And, fortunately, the Myositis Association has a wonderful website with a lot of really critical information on it. I'd also encourage people to look at some of the support organizations also for interstitial lung disease, which might include the Pulmonary Fibrosis Foundation, which has a lot of information as well. And then there's also NIH resources. So the NIH has a patient information section as well on their website. And then I think that the other part that can be very helpful is actually being a part of a support group because our patients really learn a tremendous amount from each other. And for many of the practical questions, how do you manage? Perhaps you have to use supplemental oxygen. How do you manage your oxygen? How do you arrange to have enough oxygen if you have to go to a clinic visit that's 3 or 4 hours away from where you live? Our patients are very, very supportive of each other. They're incredibly clever. They teach each other how you negotiate a life that is sometimes changed by the needs that you have with an interstitial lung disease. And so I think that getting good information, being involved with a support group, and also trying to find doctors who are specialists in certainly interstitial lung disease, but preferably in myositis-associated interstitial lung disease, because interstitial lung disease encompasses a lot of different disease types. And there are some things which are pretty unique to patients who have myositis and ILD. So there are a number of centers across the US that are ILD specialists. There are a number of centers that are myositis specialists, and then there's some that are both. And I think that trying to get information from a variety of experts to try to help figure out sort of what are the best choices that you have as an individual, and also what are the things that are going to likely help you over the long run, not just dealing with it, the immediate needs, but how are you going to be the strongest and the healthiest over the long run? And I think that it really takes that kind of integrated care between knowledge, support, and good clinical care to achieve the best outcomes.